First, let me start by saying good afternoon to everyone. And I would like to recognize those who've joined me today for this press conference. They've all played key roles as we shift to a safer reopening. Those joining us are Crystal Peterson of Yo Mama's Restaurant, Zebby Carney of Eugene's Hot Chicken, Reverend Julie of the Unitarian Universalist Church of Birmingham, and Pastor Mike McClure Jr. of the Rock Church, as well as Dr. Eden, who is part of the UAB and the infectious disease team. I stand before you today to remind you that the city of Birmingham is still under a state of an emergency. And every decision we've made, we as in the mayor and the city council, has been to solve for three things. One, it is to save lives and to prevent people from actually dying of the COVID-19. Two is to prevent community spread. And three is to make sure we gave our hospitals and our healthcare workers the support they needed by making sure there wasn't a run on our local hospitals. With that in mind, for the last 7+ weeks, we have been tremendously pleased by the support residents, Birminghamians, the citizens of this city have given to their fellow man, to their neighbor, to this community, and stepping up and doing your part to not only protect yourself and your family, but to protect your neighbor as well. And as we move forward, we continue to have to strike a balance between the health crisis and the economic crisis. And moving forward, I know many of you have personally shared with me that you are tired of staying at home, you are tired of wearing face coverings, and you want some sense of normalcy again. And I truly understand that. But as we go forward, the decisions we make moving forward, we still have to make sure that people are protected and that this community is safe. And the thing I want to share the most is this. In the pandemic, a health crisis, we all have to shift our focus and commit to a we, us, our attitude, a we, us, our belief that it's not about me or I, that we are all in this together. And with shared sacrifice, as a community, we will get through this together. With that in mind, know going forward that we will continue in this community to enforce face covers. And the reason is very simple. As the governor has reopened up many businesses in our local economy, we know that even if we want to do 6 feet apart, in a lot of places that is impractical. Because that's not feasible in doing that, we need the next best thing, and that is to wear face covers to prevent community spread in these places that are open for business. Again, this is not about me or I, this is about us. Shared sacrifice. And so remember, as you go out here into the economy, we don't want you to be afraid. This is not about fear. What this is about making sure you are prepared, making sure you are safe, and making sure you are doing the things not only to protect yourself, but to protect your neighbor and the community you live in. With that said, I would like to turn to Dr. Ellen Eaton, an infectious disease expert with UAB, to discuss the current situation and how you can help control the spread.
Thank you, Mayor. My name is Ellen Eaton. I'm an assistant professor in the Division of Infectious Diseases at UAB. I want to thank you for inviting me to be here. First of all, I just want to acknowledge that a lot of us are having quarantine fatigue, pandemic fatigue. A lot of us are really excited. The weather's warming up. We'd like to support our local small businesses, and I think the physicians agree with you on that. But as a public health professional, I want you to know there are safer ways to go about interacting in the community with gatherings and social interactions. What we're seeing in Jefferson County is that we're still seeing more hospitalizations now in our hospitals in the county than we saw early in the pandemic. So community-wide spread is still ongoing. And with that, I would caution you anytime you're going to get out to make sure you're washing your hands 20 seconds with soap, or you could use hand sanitizer before you get out and interact with your small businesses. in addition to protect yourself, but also those small businesses that we're so eager to support, we need to wear a cloth face covering or a mask. So that mask is to protect you. It's also to protect the patrons who are there in the stores, the children, the elderly folks who are also shopping, getting their hair cut, etc. And then when you're going to venues that potentially are crowded, I would encourage you to look in the window if there's a crowd, if there's a line outside. It's not the best time. There are safer ways to go. You could consider going first thing in the morning for your shopping, make an appointment for your haircut, call ahead of time. If you approach a business and you see a gathering, it is not safe for you to go inside. Make sure you have your hand gel with you. If you're making multiple errands, you're going to want to hand gel, hand sanitize in between errands. If you have children, I have small children, we know it's really hard to keep those face coverings on our kids. So the practice I have had, and I would encourage you to do, is try to keep your children with a caregiver if you need to run errands. It's really hard for them to comply with a mask. It's also hard to keep their hands clean. What I do with my boys is I encourage them to keep their hands in their pockets, hands on their hips if they absolutely have to run errands with me. And then in terms of dining out, food delivery is very safe. It's certainly safer than sitting in a venue. If you do choose to sit at a venue, make sure you're sitting 6 feet apart. So your table needs to be 6 feet from the other parties that are dining. Make sure you wear your face covering right up until you sit down at your table and start eating your meal, at which time you can remove that covering. But then when you're done, you need to put that covering back on, even when you're walking to the restroom, and certainly when you're leaving. So we want to thank you all. I know that Birmingham has done exceedingly well with this pandemic to date, and I know that is because you all have invested in the safety of your community. You've been listening, you've been washing your hands, you're wearing your face coverings and masks, and we are truly grateful for that. So we really encourage your support as we move forward, and just keep up the good work. Thank you.
Thank you, Doctor.
I'm sorry.
I want to thank Dr. Eaton for sharing those remarks with us. And I want to remind folk in our community that it's really, really important, not only as elected officials, but you as everyday citizens, really pay attention to what our health experts are sharing with us. They've continued to share with us that those who are most vulnerable, those who are over the age of 65, those who have pre-existing conditions or any immune deficiencies, as well as underlying health issues, you're to take extra precautions. But I want to speak to the folk who may have family members that meet those categories. It's important that when you go out here, before you interact with that person that is over 60 or 65, before you interact with that person that has those pre-existing or underlying health conditions, please take the extra step to make sure you're doing everything you can to protect your loved one. With that said, Dr. Eaton, along with restaurants owners, including Eugene's, has worked alongside with Jefferson County Department of Health and the City Department of Innovation and Economic Opportunity to form a working group to create guidance for a safer reopen of restaurants and bars in our city. Not every business is ready to reopen, but those who have opened or will open soon will be equipped with information from medical experts and fellow restaurant owners. Dr. Josh Carpenter, who is director of IEO, is here to discuss this working group.
Good afternoon. On behalf of Mayor Woodfin and the members of our council who helped put together the guidelines that are now online at www.birminghamal.gov/coronavirus, we are grateful. There are a number of things happening inside our world and inside Alabama. As we've reopened restaurants, we wanted a Birmingham solution informed by local Birmingham restaurant owners and as well as our local health experts to make sure that consumers or people who wanted to continue to patron the places that have meant a lot to them, to their families, would have the type of guidelines they needed to go to those places with confidence. Dr. Eaton and Dr. Williford and Bruce Bowden at the health department set arm in arm with Amanda Story at Jones Valley Teaching Farm, Partis Stitt at Highlands Bar and Grill and the other Stitt restaurants, Zebby Carney at Eugene's Hot Chicken, John Hall at Post Office Pies, and they came up with a solution and a set of guidelines that we think draw in and draw upon the best practices in public health research, as well as the National Restaurant Association guidelines. We've put some information online there today. There'll be more forthcoming as we continue to open up and ease restrictions. But our goal is to make sure that the consumers that have for so long sustained small businesses in Birmingham, like Yo Mama's and so many of the other establishments that have built a quality of life that is enviable among Birmingham, that they have the type of confidence that they need to go out and continue to purchase food. We're grateful for all the small businesses who've continued to take risks, who've adapted their models, who have reconfigured everything about their business model to make sure that they can serve the products that have characterized their companies. And we appreciate that ingenuity, and it's exactly that type of ingenuity that we need to get us through to the next stage of development in our economy. We're grateful for your participation, and thank you for helping us keep BHAM strong.
Thank you, Dr. Carpenter. And I want to thank each of you who have put safety first while also supporting our local businesses through delivery and curbside pickup. What you're doing is help make sure that we're prepared to thrive again when we move beyond this crisis. But again, let me caution you. The best thing we can do is make sure that people are safe is by staying at home. But if you do have to come out, make sure that you follow some of the guidelines and recommendations that our local health experts have provided you. Now, even though the state has lifted restrictions, our local health leaders have urged people to wait before moving to larger gatherings like church services. And so I want to thank our faith leaders who have worked closely with me to educate their members and make thoughtful decisions to keep our residents safe. One of the first faith leaders I want to bring up this afternoon is Reverend Julie Conradi of the Unitarian Universalist Church of Birmingham.
Thank you, Mayor. The Unitarian Universalist Church is a multi-faith community in Birmingham, and we are committed to having our services virtually on YouTube until medical experts advise us otherwise. We think it is the only way to fully protect our community, our children, our elders, and all people who come to worship with us. I just want to take a moment to point out that this pandemic has been a great opportunity for us to recreate some of the ways we do things. This is not about going back to normal. There are more ways that we can care for folks and love on folks than we have been experiencing before this pandemic. One of the advantages to having services online is that they are accessible to more people. There is no longer transportation issues. We can reach people in the hospital. We can reach folks who are at home caring for elders or children. And this is a really important opportunity that we can make as faith leaders in our community to say all people are important and all those who want to come into our community are welcome. And the online format has allowed that to happen in some very magical ways. There are also some ways that we need to continue to be physically present for those in our community that we need to care for. We need to continue donating to our food pantry and making sure that there are accessible ways for people to get healthy food. We need to make sure that folks are cared for in the best ways possible, and those are experiences we can only do physically. And we hope that you will take those recommendations to care for others, to love our neighbors in the ways that are recommended by our medical experts and our city leaders. This is an opportunity that we can continue to care for one another. Please continue doing so. Thank you.
Thank you. I now would like to bring up Pastor Mike McClure Jr. of the Rock Church, and has been a very active, not only faith leader, but community leader in making sure that we do everything we can to support those that are in need during this COVID-19 crisis.
Thank you, Mr. Mayor. I must admit that I approached this topic with much trepidation, understanding both the gravity and gravitas of this moment. Seeing that Birmingham, Alabama is the epicenter for African American elderly individuals with pre-existing health conditions that are being impacted at a disproportionate rate, I believe by faith we should make wise decisions on opening or remaining closed in our churches. It's my heart's desire that we will impact our community like never before, and having service virtually is doing that. It's my prayer that you would listen to the king of quarantine, who is Noah, that although the rain had stopped, the water had subsided, people were telling him, signs said he could come out. He listened to God concerning those he was entrusted to. So if by chance you intend on opening your services this weekend, a couple things we ask from you. Number one, healthy practices. Prop all of your doors open. You can call our church, 205-798-7621, and we purchase a couple thousand masks that we will be able to deliver to your ministries if you plan on reopening. But I strongly pray that you would consider remaining virtual, because it's not just about our lives, it's about the lives that can be impacted in the process. I pray right now for our city. I pray right now for our elderly. I pray that you continue to give our city leader wisdom and guidance during this pitiful pandemic. It is in Jesus' name, the Christ, we pray. Amen.
Thank you, Mr. McClure. Listen, before we take questions, I just may have two notes. The first note is this. We know that community spread is very easy in the following places: elevators, public restrooms, choirs, weddings, funerals, and believe it or not, churches as well. So it's important that we consider the environment we're in and do everything we can to protect ourselves. The other thing is a thank you. I want to thank the citizens of Birmingham again. Over the last few weeks and over the last month, you all have stepped up, you all have showed out, and you've done what's necessary, again, not only to protect you, but to not only protect your family, but to protect your neighbor in this community. Please continue that effort. Please continue to show compassion, and please remember that we're all in this together. With that, I turn it back over to Rick, and we'll begin take any questions you all have.
Thank you, Mayor. I will call out to our reporters when I call out your news organization. If you will please unmute and ask your question. I believe the first question we have at AL.com. Do you have a question? Anna, do you have a question?
Mayor, can you update us about some of the city's efforts to get more information about who is infected, or more information about those who are infected in Birmingham? I know that City Council President William Parker has talked about this in previous weeks. Do you have any more information on those efforts?
Yeah, I think as the Jefferson County Health Department, I spoke with Dr. Mark Wilson, not this past Friday, but the Friday before. So information was revealed county-wide as it relates to those infected throughout all of Jefferson County. I think the additional information as we dig deeper based on our city versus other cities within this county, Jefferson County Health Department is still digging through that information and trying to, strike the balance of HIPAA versus what they can share based on zip code, based on age, based on race, based on gender. We don't have that information yet, but we look forward to receiving that information. And I think the biggest thing we can do is once we're armed with that information, that allows us to be in a better position to continue to share with our residents. This is why we're taking these efforts, because a lot of our residents are vulnerable or susceptible to not only getting this virus, but making it and having a hard time recovering from this virus.
Let's go to, is Birmingham Times on the line? Birmingham Times, do you have a question at this time for the mayor? Birmingham Times, Erica? We'll check back in. WBHM Radio, do you have a question for the mayor?
Yes, I do. Hey, Mayor Woodfin, it's Randall with WBHM. I just wanted to check in about the extended state covering ordinance. I know it's been extended until May 22nd. Is there anything that has changed within the ordinance other than the extension?
Yes, I think the question dealt with the City of Birmingham and City Council today. I want to thank the City Council for voting to extend the face cover ordinance in the City of Birmingham. It has been extended to May 22nd. In addition to that, there was an additional exception that was placed in this order today related to those who are going out into these places of business that are open for restaurants, breweries, lounges, as well as bars for eating and drinking.
WBMA, actually, they were disconnected for a moment. I've got a question from ABC 3340, Andrew Donnelly. Are businesses responsible for who they are allowing in as far as masks go, or does that fall on the individual? Can a business get in trouble for allowing someone in without a mask?
Yeah, so where we are today is this. Business owners have every right to refuse a customer that comes in without a facial cover, the same way they would allowed to refuse a customer that comes in without a t-shirt or shoes on, or anything else that restaurant owner deems necessary for a customer to be able to engage that business. That's at point of sale or at entry. I want to remind people that there is an ordinance in effect, and it says that if you are outside of your home, with certain exceptions, you have to wear a facial cover. I understand that many people may have some thoughts about this, but again, this is temporary, and this is shared sacrifice, and this is about we, us, our, and a community effort to protect all citizens. It's not just about you. And so in that regards, when a person walks into or attempts to walk into an establishment, that business owner or that employer has every right to refuse a person or refuse someone who does not have a facial cover on if they choose to.
Birmingham Watch, I believe Sam Prickett's on the line. Do you have a question at this time?
Hey, yeah. So of the changes to the ordinance that were approved today, in remaining difference is that face mask ordinance. And I know a few weeks ago, Attorney General Steve Marshall sent a letter expressing concern or maybe a warning about the enforcement side of that ordinance. With the ordinance continuing, do you see any further conflict with the state on this? And if so, how will you address it?
No, Jefferson County, City of Birmingham is the seat city of Jefferson County. Jefferson County, of all 67 counties in the state of Alabama, has the second highest number of cases, and the second and has a higher than other counties as it relates to deaths, outside of Mobile and a few other counties. In that regard, it is incumbent upon us as local officials to be in constant contact with our local health experts. They have continued to share with us that it is important and take their recommendations that face coverings are needed if we have to offset less social distancing because more businesses are opened up. If we have to safeguard against not having enough testing and or enough tracking and tracing as it relates to those who get this disease, and for guarding against, we have not seen a decrease over the last 14 days. And so as plainly as I can put it, the City of Birmingham is very busy fighting the COVID-19 and fighting the coronavirus. We don't have time to fight any other elected officials. We're doing everything we can that's necessary to protect the residents of the city, and I'm happy to say that most of the residents in this city are complying with the efforts we put in place from a public health standpoint.
Okay, our next question, WBRC, Alan Collins, I believe you're on the line, WBRC.
Mr. Mayor, you now have extended the face covering ordinance to May 22nd. What do you have to see happen in order to say people can get rid of the mask?
I think it's two things that the City of Birmingham and would like to see. One is that the health experts are telling us that things are getting better. I think embedded in that, getting better is defined as cases are actually decreasing in our city, that we've improved testing, we've improved tracking and tracing, and that there is less community spread. I think if those things are not in place and we continue to listen to the advice and guidance from health experts, and they tell us we should continue this, then that's what we will do. And I will do in consultation with the council and continue to receive community feedback from those in our community.
WIAT, Do you have a question for the mayor? Or do you have a question for anybody in the panel?
Yes, Lee Rankin with CBS 42 News here. Mayor Woodfin, how often do you speak with Governor Ivey, and are you given the opportunity to offer input on statewide health orders?
The question was around how often do I get to speak with the governor, and have I had the opportunity to offer any input on the health order? I'll answer the second question. No, as mayor, I have not had any input on the actual state order, but I have had a chance to speak with the governor a few times in the end of April and the beginning of May, as well as speak with the governor's chief of staff, along with the 9 other mayors of the largest cities in the state of Alabama. We've all expressed different things, but we've all had an opportunity to share where we are. I think the audience and that we've been afforded with the governor is to simply say this: every city, every county is not the same, and we don't believe one solution or one suggestion fits all. And so if there are areas in the state that have a higher number of cases, if there are areas in the state that have more people susceptible or vulnerable to this virus, then please give us the window to make sure we're doing everything necessary in consultation with our local health experts to make sure we are doing what we can to protect our citizens. I believe that's been afforded the mayors across the state, not just Birmingham, and we will continue to walk in lockstep with our local health experts to make sure the decisions we make are not politically driven, but are 100% health driven.
WVTM, do you have a question for the mayor? WVTM.
Yeah, Mayor, this is John Babke, and I had a question. One of your own city councilors, as you've heard today and in previous meetings, has called the extension of the mask or face covering ordinance a government overreach. Why, in your opinion, is he wrong?
I don't think people's opinions as it relates to should face covers be mandated by the government a matter of right and wrong. I'm very comfortable with and open to the idea that many people have different various opinions and or ideas about facial covers. I've had so many conversations with local health experts in this community, and to a letter, every one of them believes that people in our community should be wearing facial covers. And if you have a city like Birmingham, again, where 1 out of 5 people are over the age of 60, if you have a community in a city like Birmingham where you have a higher black population than any other part in Alabama, if you have a community in a city like Birmingham that unfortunately has so many people with underlying health conditions, and the type of health conditions where if they get the COVID-19, that places them in a position to be either hospitalized, put on a ventilator, or worse, die, then the steps we take are going to look very different from other parts of the state. And we are okay with that. And I am okay with people disagreeing with what we've done. I'm real. Everybody's not going to 100% agree with every decision we make. But what I can tell you, every decision we make is based on protecting people. And the beauty of this conversation as it relates to face coverings, this is 100% driven by not only what the health experts are telling us and the guidance they're giving us, but it goes to one thing, that is to save lives. And that is what we're doing, and that is what we will continue to do.
Summit Media. Sheila, are you on the line? Do you have a question for the mayor?
I do have a question for the mayor. Mayor, in regard to, I want to segue just a tad bit from how are you protecting those folks who come back to work, people who are coming back to work? What are the new parameters inside of City Hall?
I want to remind the public and the community that City Hall never closed. We immediately went into several protocols to keep not only City Hall open, but to keep it safe when people from the public came in, as well as for the employees that were still working here every day over the last 7-8 weeks. Those things include opening our doors, making sure there's less hand touching of doors. In addition to that, we put hand sanitizer outside of elevators of each floor of City Hall. In addition to that, we've also put hand sanitizer in each elevator We have 3 working elevators in City Hall. There's some other things we've done, which include our own internal team cleaning the building as it relates to those areas that are mainly touched by people, which includes light switches, doors, door handles, and other and elevator buttons, etc. And we've also contracted with a third-party organization to make sure that there are deep cleans at city facilities that are open to the public, which include City Hall, the Birmingham Police Headquarters, the City Jail, and the Municipal Court. The last thing I will say to this, as our employees come back to work, we've been at it working really hard around policies and procedures in place to keep our residents safe from a health standpoint. In addition to that, internally we will be requiring that employees who work in our city facilities will have to wear face coverings for the foreseeable future. And if you enter any of our city facilities, you also, as the public, will have to wear a facial cover to make sure there's not community spread.
Pat Byington, Birmingham Now. Pat, do you have a question?
Yes, it's actually a question for Dr. Eaton. I know she led the effort to make sure that there's enough personal protection equipment for the doctors and nurses and staff at UAB and area hospitals. Do we have enough supply, and is there coordination with the city on that?
The question is from Birmingham Now, do we have enough supply in the hospitals? Is there coordination with the city or the Unified Command on that at this time?
So thank you for the question. So my understanding in working with the county and the city is that we have worked really hard to secure lots of resources for now. We feel we're in a good position now if we continue with our current safer at home, masking, hand hygiene, and doing the best we can to avoid close gatherings without those preventive measures. So I think we feel we are in a good place currently. However, acknowledging the way this virus works, exponential spread, that 1 or 2 clusters around the city could easily change that scenario very rapidly.
Thank you, Dr. Eaton. Okay, we have time for one more question. I'm going to put it out there. Is there anybody that we haven't had a question from, or is there anybody who has the last question? We'll get the first.
Well, I'll answer that first. As mayor, I've taken huge pride in having direct conversations with small business owners, not only in our downtown area, not only in our Lakeview and Avondale and South Side area, but also those small business owners in the 4th Avenue Black Business District. I've had a chance to talk with the small business owners in North Birmingham as well as Inslee and other areas of town. And it's not just restaurant owners; it's local retail owners, and it's all type of small business owners in this city. And the truth is this: it has been painful, hard conversations, especially on the receiving end, for me to listen to, of the things they've had to deal with as it relates to furloughing or terminating their employees over the last few weeks. It has not been easy for our local business owners. And we have attempted to offer all type of relief we can. As you recall, we came out of the gate with Birmingham Strong many weeks prior to the CARES Act and our local businesses being in a position to draw down on federal dollars. We took it upon ourselves as a local community in partnership with the private sector to make sure we gave a lifeline to those small business owners. Now we are in a position, again, to continue to listen to our small business owners, and it's very simple. As we move into the reopening phase, City of Birmingham will stay in a position to provide relief for the small business owners all over town and the restaurants outside of our city center, how can we be creative and make sure that even if restaurants are only at 50% capacity based on the state's order, we figure out a creative way to provide relief? I'm happy to share with you. Many suggestions have been offered to us. I look forward to sharing those publicly very soon about how we continue to ease the pain and be on the creative solution side of addressing, supporting our businesses all around the city in all 99 neighborhoods.
Thank you, Mayor.
Let's,
Yes, Jarvis. Okay, Jarvis, with what's happening in Birmingham, gets the last question in. Go ahead, Jarvis.
Okay, this is for Dr. E. Was any suggestion at the beginning from the restaurant to require them to require their employees to get temperature checked or also even go get tested just in the first 30 days? Just to give the employees peace of mind about coming back to work and engaging with the public?
Jarvis, let me, as Dr. Eaton comes up, I'll repeat your question and correct me if I'm wrong. Dr. Eaton, is Jarvis Patton with what's happening in Birmingham was asking, is there any guidance for restaurants and bar owners as they open up where they are recommended to either check temperatures for employees or any other steps on that? Is that correct, Jarvis? Is that essentially what you said?
Yeah, they even get tested,
Or get tested.
Yeah.
Thank you for the question. I think it's a great question, one we've been getting a lot of, but what we're learning is that about 40 to 50% of folks that have coronavirus are asymptomatic. So testing with a thermometer exposes people to secretions. It is an infection prevention risk, touching the actual thermometer, and you have to acknowledge that you're going to miss quite a few folks who have the infection and are shedding it, but don't actually have a fever yet or may not develop a fever. So in terms of things you can do to protect your staff, educate them on socially distancing at work. Make sure there's plenty of hand hygiene stations and they have adequate time to wash their hands. They need to be wearing cloth masks in the work environment. Can you do shift work? Can you space out the amount of people in one space at one time for food prep so that they have that 6 feet of distance between one another? And make sure that they know that it's an honor system, that we're all doing our part. If they're sick, if they start to develop a headache, fever, if their roommate comes down with the virus, educate them and make sure that they feel comfortable self-reporting to you that infection risk. What we don't want is we don't want employees to feel like they have to come to work and such that they would come to work ill. And so really, if you can think of things that they can do and continue to earn a wage, can you put them in a back office at their house? Sorry, not a back office. Can you put them at home while they're quarantined? Can they help with your scheduling? Can they help with your website? Can they man the phones and take some food orders from home while they're in isolation, either because they're infected or because they had a contact or they're waiting on a test? Think of ways that you can continue to employ them in a safe way away from your other employees and clients and customers. So those would be some of my recommendations. Thank you.
As we close out, I want to thank the Birmingham community for doing their part. I also want to thank everybody for being here today, our community partners in the faith community and the business community, and our health experts from UAB for